Now, I understand that in certain countries, the choice of mesenchymal stem cells will differ from Malaysia. Now, in Malaysia, we normally will get the donated umbilical cord derived mesenchymal stem cells. And prior to actually processing the stem cells from the umbilical cord, of course, it goes through a lot of testing first to make sure that the cells, the donor is a safe donor without any medical conditions like cancer in the family, without any history of degenerative conditions, whether it's neurological or any organs in the family. So the donor source has always been an important step in before we actually process any cells from the donated umbilical cord. And over the years, it hasn't been any issue with authorities shutting down any labs with lapses in this kind of, I would say, prior checking and testing before using the donor umbilical cord. Now, in certain countries where you don't have donor umbilical cord derived mesenchymal stem cells, the other routes of getting the mesenchymal stem cells will be either from the bone marrow. You will put a needle into the bag and aspirate the bone marrow, or you do a liposuction to get the mesenchymal stem cells from the adipose tissue. Now, the only problem with Parkinson is also they are adults, and some of them are already quite old. So you will assume that the body is not as healthy as a newborn baby, plus the adult Parkinson's disease patient is not in the best of health, plus they may have also diabetes, hypertension, and some organ dysfunction. Hence, the stem cells quality may not be as good and not as potent and not as robust as young newborn stem cells. So we decided that to be sure of getting good quality stem cell at every treatment, we have resorted to just using baby's umbilical cord. The other thing about getting your own stem cells either from the bone marrow or from liposuction is that you have to come back at least 2 times. All right. First, we have to do the harvesting of the stem cells from either the fat or the bone marrow. We have to send to the lab. The lab will then have to isolate the mesenchymal stem cells. And if they are good enough to be cultured and expanded, then the lab will undertake the process of doing that. And because they are also not as strong, as robust, they cannot proliferate. That means they cannot multiply as robust as the young cells. It will take longer time. So the treatment can take a prolonged stage before you actually get a treatment. While if we use a donated baby umbilical cord derived, it can be done anytime when the treatment is planned, because these cells are ready off the shelf treatment.